The secret to better health is exercise. And I have somebody who is best suited to explain to this today. My good friend, Dr. Rob Berghorn from Ascent Physical Therapy. How are you doing today, Dr. Rob?
I'm doing amazing, especially being here sitting with you, Ahmed. How are
Uh,
you today?
you're too kind, man. I'm doing all right. Doing all right. Going through another crazy hair day, but that's just another day in my life. Um, Today, I'm very excited about this conversation because we're going to talk about exercising for people over 50. But before we do that, I want to talk a little bit about you because what I know about you is first and foremost, you're a great person. Second of all, you're a great professional and you're a physical therapist, doctor of physical therapy. You're an Olympic weightlifting coach and you work with a bunch of endurance athletes and you do some endurance stuff yourself. You ran a pretty crazy amount a couple of days ago, didn't you?
Yeah, I did. Yeah, one of my friends, she did a charity event where she ran 85 miles. I was supposed to do more with her, but I'm dealing with a little bit of injury myself, so I was only able to do 14. But it's still a good amount of time.
Yeah, only 14. That's
Only 14.
yes. That's how you know we're talking to somebody who's really in this, man. So okay, so you're very into the endurance world. Tell me a little bit about yourself and if there's something that you want to tell me, sort of how did you get into physical therapy and tell me more about that.
Yeah, I mean, my just to keep it concise, my journey started back when I was in high school, and like I was a endurance athlete back then. I was on track and field team. At that time, I was a sprinter, and then I continued that up until college. And by the time I was in high school, I took an anatomy class, absolutely loved it, wanted to be in the medical field. So then this was that diversifying of where I wanted to go. I thought about medical school, but I didn't want to keep giving people medicine. I didn't want to keep giving people injections. I wanted to physically help them get better and do what they needed to do. So I thought physical therapy was the best route. I went to Sacred Heart University up in Fairfield, Connecticut, where I got my bachelor's degree in athletic training. And like I worked with a number of teams while I was there. I worked with club sports. I worked with women's basketball, men's football, rugby. I worked with women's lacrosse. I worked with men's lacrosse. I worked with volleyball. I worked with pretty much all the sports all throughout colleges in my area, and also some high school athletes as well. And from there, like I took my doctorate degree over at Stony Brook here on Long Island, and from there I've been working with athletes ever since, and the general population, active adults as well. When I was working in corporate physical therapy. And about 2 years ago, I left to do my own thing and create a specific niche for endurance athletes so that they can get the best care that they need.
Love that, man. Love that. Well, you are a fellow Seawolf, so once again, that's amazing to hear that you got your degree from there. I mean, that's a really good school. And listen, thanks again for being here today. I wanted to kind of delve into the topic today about exercising over 50, if that's okay with you.
Perfect.
Okay, beautiful. So just to start off, I mean, what are some common misconceptions people have about exercising when they're over 50?
Yeah, I mean, there's always those recommendations we get from the FDA and the general health practitioners around the world saying everybody needs to exercise over 20 minutes, everybody needs to do a certain amount of activity during the day, and that is very true. But a lot of times, it's the hard part is starting. It's getting into that routine. It's building that thing, especially if you haven't been doing it for most of your life. It's definitely hard just getting started. And sometimes it does help getting in front of a professional like you or me. But at the same time, getting into exercise over 50, most people start talking about it and saying, like, I'm too old to do this, or this isn't right for me. None of my friends are doing it, so why should I be doing it? Am I crazy for doing this kind of a thing just because I want to make myself better? Or should I be doing this because I want to live longer, I want to feel healthier, I want to feel younger than someone who is my age or someone who's even younger than me? So those are all possible things. Sometimes you just need to get kick-started, and sometimes you just need to be working with somebody in order to get there.
Definitely. I mean, I completely agree that the power of exercise to help people feel younger, like you said, feel better and age gracefully is incredible. I've seen that myself. I'm sure you've seen that. But definitely don't, you're a doctor of physical therapy over here. I'm a personal trainer. So we definitely see some things differently, I'm sure, as much as we see things in a similar light. let's talk a little bit about physical therapy for a second. So if
Right.
you could, what is physical therapy?
Yeah, so I mean, physical therapy in the traditional sense is about function and regaining function after injury, but that's not only what we do. We are across all aspects of medicine. So we treat everybody from birth to death. We treat everybody from injury to wellness to performance enhancement, depending on what you need to do. A lot of the times we do have that more in-depth medical background. We do have that more in-depth understanding of the whole medical system itself and what the ins and outs of what goes on, before surgery, during surgery, after surgery, if you're having those kind of issues going on, how things go for injuries of themselves. So looking all the way down from the cellular level, all the way up to body systems and working anywhere in between to try and be able to best help you. A lot of the times when you go to a regular practitioner nowadays, it's kind of like a cookie cutter kind of program, which is very unfortunate, and the things that are happening in medicine right now. And this is not only talking about physical therapy itself. That's part of my thing. It's across the board. It's across all medicine right now, where you barely get to speak with somebody for 5 minutes, and you're waiting for sometimes 2 or 3 hours to even see them. Sometimes an hour or 2 hours after your appointment was supposed to happen, and it's not something that should be going on. But at the same time, we're trying to, at least people like me and you, we're trying to make things different. We're trying to spin things around. We're trying to make it so that whoever is consuming healthcare, whoever's consuming health and fitness, is getting what they need to make sure that they're not only getting healthier and feeling healthier, but also understanding it, making sure that they're being educated in what they're able to do. And that's part of my big thing, and making sure that you're walking away so that once you do feel better, you don't necessarily need me. I'm always here as a resource for you. I'm always here as an educational resource for you. But it's something of you taking away things and being able to take it throughout your life. And getting back to physical therapy, it is what that should be: is education, making sure you feel good, helping you with whatever you need help with, whether that's getting on and off the floor, getting on and off the toilet, recovering from an injury, improving your performance in sport, whatever it is. That's what we're here for: breaking down your function and making that better.
And this is one of the things I love about you. You look at things that really like a system view, and the fact that you could see what's going on in sort of the healthcare system and that cookie cutter approach, and then for you to be courageous enough and to be caring enough to actually listen to the people that you're working with now and the way that you educate them. I mean, I've heard so many great things about the way that you do some of your work. Did you ever come across somebody who was sort of apprehensive about getting started when it comes to exercising, and what were some of the things that they said?
Yeah, so I mean, it happens all the time. I mean, if I can talk about it from the exercise sense, and I also can talk about it from the physical therapy sense, only because I've seen both sides. I've worked with both sides of people, and for someone who is, we'll keep it into the example of someone over 50. It's very hard to try and change some of the old kind of habits that people have. And if someone is sitting there in front of you and they want to change it, you do have to create a relationship, but you can't always be like that. We've had this relationship between us for over a year now, and we've been talking on and off. But when we started talking, we didn't get married right away. We started talking about things. We became friends first. Then we became a little bit more. Now we're colleagues, that kind of thing. So I mean, it's a relationship. So once you first start talking to somebody, that's how I like to break it down. It's a relationship that you're developing, and you have to develop that level of trust first. Because if you don't have trust, they're not going to listen to you. If they're not going to listen to you, their program is probably going to fall off. So that's how I like to break it down. I like to make sure that you do have that first, that built up relationship.
Wow.
And that's one thing that starts as well is, once they're in the doctor's office, if we're going to talk about the medical side now, they're in there for 5 minutes. They get told that this is what you have to do and this is how you have to do it. And then, they're not sure what to do. They do this, they do that. And sometimes people come in to see me and they don't have trust because they've either been to X, Y, and Z doctor, or they've been to X, Y, and Z chiropractor, acupuncturist, osteopath, and I'm maybe the third, fourth, fifth physical therapist they've been to, but they haven't sat down in front of somebody who can actually listen to them and be able to kind of build that kind of relationship and understand where their fears are coming from, where their frustration is with what they're dealing with, and break it down for them to not only help them understand what they're going through and create that emotional side of things first, and then go into the actual recovery and the rehab.
100%, man. Yeah, the emotional aspect of everything is super important, right? Because like you said, people are usually apprehensive about starting or changing their habits to go from a place where they're not exercising to exercising. And a lot of that has to do kind of like what you're saying about the trust aspect of the relationship that you have with a practitioner or a professional with a client. And so, what I want to know, and how do you see this? Like, where do you think the lack of trust has come from somebody who's over 50 and wanting to get exercise in versus practitioner? Where do you think that lack of trust is coming from?
Yeah, so I mean, I want to say that's a more complex question, just only because there's a lot of things that people get fed every day. It's not only, especially now, it's not only just medical practitioners that are saying like, this is what you have to do, and they go to somebody else, this is what you have to do, and it's confusing. So I think a lot of people get that confusion in the medical system itself. But now you have commercials that are on TV. You have ads that come up on your phone when you're on social media. You have ads that come up on YouTube. You have ads that possibly pop up on Netflix. You have commercials that pop up all the time saying you have to take this, this, and this supplement in order to be healthy, and you don't know which one to go. So I think confusion and trust becomes an issue in that sense, because there's so much overload in the commercial sense that it's hard to kind of pick out and figure out what's going on. So, it's everybody's very individual and everybody's very specific. So whatever you're hearing may not be what's specific to you. If you're sitting in front of a practitioner and you're not coming to that practitioner without a list of questions, like a physical, either written out list of questions or an understanding one in your head that's systematic as far as like what you need to understand before you take on that kind of treatment that you're going to go through, maybe you're not sitting in front of the right person. Because when you get in front of that person and they can't answer that question, they're probably not the one that you need to be seeing. You want someone who's going to give you that specific answer for whatever question you have about what you're confused about. And you shouldn't be afraid to ask those questions, because if you're afraid to ask those questions, then I don't know, you may not be 100% in on what you're doing, or you may not be 100% on entrusting that person. You may be apprehensive going into that kind of intervention that you may be expecting to have.
Yeah. No, and that's a really good way of putting it, especially because, like you're talking about, the commercialization, sort of the fitness and health industry, and how that disrupts what really it ought to be a relationship between somebody who's wanting to listen and somebody who's wanting to understand what's going on with the person before going in and making physical changes to their body with exercise. I think that's an immense opportunity there in order to create that trust, to really develop that relationship. So since we're on the topic of relationships, what is the relationship that you see between exercise and somebody having better health?
In better health, are you talking about someone who has, saying like high blood pressure, high cholesterol, that kind of thing, or how you want to go with that?
Yeah, I'm sorry. Let me rephrase that question in a better way.
Yeah.
What is the relationship that you see between exercise and between feeling younger?
Okay. Yeah, so I mean, this is loaded in the sense of, as we get older, especially after the age of 35, we start to have not necessarily degeneration, but we start to have aging. Normal aging starts to occur. We start to lose bone mass, we start to lose muscle mass, we start to lose power production, especially more of our females. We start to lose more of that, every year after the age of 35, every male starts to lose about 1 pound of muscle, and every female loses about 1.5 pounds of muscle. So if you're not exercising, if you're not doing some kind of activity, you may feel like you're starting to get weaker. You may start feeling like you're older, you're achier in the morning. You may feel like you can't do as much. You may feel like you're not having as much energy. So the fact of being active, doing some kind of a physical activity, it doesn't have to be anything too strenuous, but it could be as much as you want it to be. At the same time, doing some kind of resistance training, especially for females, I always like to preach that is very important to maintain not only muscle mass, but also density without feeling like you have to be bulky, only because, the stronger you are, the less stress that's going to be on your bones, your spine, and all of those vulnerable structures, the better mechanics you're going to have. And on top of that, the better you're going to feel, because your muscles are there to absorb force. They're there to create force based off of the information that you're receiving from the activity you're doing, even including walking. So if you're able to better distribute force, regardless of what activity you're doing, the less stress that's going to be implied on your body in general, the less discomfort you're going to feel, the less soreness you're going to feel, and the better you're going to feel day in and day out going to have.
Yeah. And so you're saying that if you exercise, you'll start to feel less stressed, you'll start to feel much better, and you're going to start feeling younger, much better in your day to day. So what? Let's go back to this, because you talked about how males will lose about a pound of muscle, and you talked about how females lose about a pound and a half of muscle. Why is that important? I mean, what's the significance of having muscle?
Yeah, so I mean, the significance of having muscle. So I mean, for example, you know, like when we're going to get on and off the toilet, or if we're going to pick up something from the floor, you need a certain amount of effort in order to get that object off the floor. It can be as small as a penny. Mm-hmm. It can be as large as your 5-year-old child. You know, your child, especially if you're a female and you have young kids, if you're younger, now we're talking about if you're a grandmother, if you're over the age of 50. Yep. So, you know, if you're picking up your grandchild and, you know, they're not getting any lighter, they're not getting any younger, they want Mimi or Pop Pop to pick them up, you're going to want to pick them up regardless of how strong or how weak you are. So being prepared, not only in the sense of doing it with the appropriate mechanics, but also being able to lift that is what's going to be important. You don't want, you know, we get back to the emotional component, is if you have that inability to pick your grandchild up because, you know, you're going to hurt yourself because you tried picking up the apple that fell on the floor the other day and you couldn't do it because you hurt your back, trying to pick up your grandchild is not going to feel great. So, you know, that's the whole thing. It's not only the physical aspect of strengthening in itself, it's the emotional component of, you know, being with your family or doing things with your family and doing those kinds of things. So that's how I always relate to it. It's always the functional things that are easy and that you can miss out on, including, you know, like I said, getting on and off the toilet, doing a lot of different things that are functional that sometimes doctors even tell us not to do. Oh, you shouldn't be squatting anymore. Oh, you shouldn't be deadlifting. But, you know, that's involved in everything that we do during our day. Getting on and off the toilet, getting in and out of chairs, getting in and out of the car, and, you know, picking things up from the floor.
Right. Picking things up from the floor, picking up your grandkid, having those emotional connections that you have with your grandkid when you're able to pick them up, when you're able to, you know, do the stuff that you want to do without feeling discomfort because of the lack of your ability to actually do those things is super important, and a very important piece of how muscles relate to the emotional aspect of things. By the way, I'm sorry if any of you guys heard any of the phone ringing or anything like that. I think that was on my side, so I just wanted to bring that up. Let's continue moving forward from here. So you mentioned resistance training at some point. Mm-hmm. What is resistance training?
Yeah, so I mean, I kind of want to lead this into, you know, we do have a comment down in the comment section here, and I do want to answer that and kind of lead into the question that you just asked too, because it fits in with what we're going to talk about. Yeah, so walking is definitely a good start to exercising for someone who is 62. You know, walking is definitely something that we can do every day. You know, it's something that, you know, is a good start. It's definitely a good thing to get going with, but shouldn't be the only thing that you do. Doing some kind of extra activity, even if it's, you know, you're getting in and out of a chair multiple times, you know, that's definitely another good start. And that's what leads us into that resistance training. Because if it's, you can get in and out of a chair once, and that's just like normal day activities. But if you can do it multiple times, that's a load that you're adding on and a level of intensity that's a little bit different than what you're normally used to doing. So you do create a level of fatigue, and you do create a little bit of what we would consider in the fitness world overload. And overload will create muscle, because there is some level of muscle breakdown, which will be, again, rebuilt on top of it so that you're able to do the activity better next time. So to answer this question a little bit further, you know, we talked about resistance training a little bit, and leading more into that resistance training, especially for females, whether they're premenopausal especially, but also postmenopausal women to help maintain and improve bone muscle mass, especially if you have osteopenia or osteoporosis, making sure that you do have graded muscle strengthening or muscle resistance training, just so that you're able to do it safely, do it appropriately. So getting in front of a fitness professional like yourself, Ahmed, or getting with someone like me to get you started and help you educate you on what is appropriate and what you should be doing, instead of just going to the gym and trying to do all these different machines that you may not know exactly how to do it correctly, or doing any kind of specific activity where you may not understand the appropriate movement. And then you feel very sore, you feel very uncomfortable, you may have a lot of pain because you went and overdid it, which is very classic for people trying to get started. So if you're not sure about what to do, getting in front of somebody like either one of us is important to help understand what exercise should be for you right now, and then kind of build on top of it, whether you stick with one of us or if you do go off on your own. As long as you get that first little bit of education is what's going to be important. As far as resistance training itself, it doesn't have to be anything too crazy. Like I mentioned before, it could be getting in and out of a chair multiple times. That's a good start. But if you start doing that same exercise, but you do it while holding something that's 5-10 pounds, that's when we start adding things to ourselves in order to give us resistance, something that's outside of ourselves that weighs more than us together as a system, in order to create more force and be able to build strength, build muscle on top of it. So creating that overload, like I mentioned before.
Awesome. So you're saying resistance training helps you create an overload, which helps you put on muscle, and muscles do stuff like offset the effects of osteopenia, and
right.
Moving forward, it can help you continue to do stuff like play with your grandkids or do whatever it is that you want.
Right. And for example, yeah, let me further clarify things a little bit, just because of how the muscle strength connects to bone health.
Yeah.
Because you know, muscles are muscles. They're attached to tendons. Tendons are attached to bone. If you apply stress to bone, bone will over time replenish itself and replace itself. All of our cells are replacing each other all the time. So the more stress you apply, the graded stress you apply, the small levels of stress that you can layer on top of each other over time, the stronger you get. Not only muscular wise, you will get stronger bone wise, because your body's able to withstand the stress that you're applying. So for example, if today we're only getting in and out of the chair with 10 pounds in our hand, and 3 or 4 months from now we have 45 pounds in our hand and we're getting in and out of the chair and we're doing it fine, you're stronger than we were before, and you may have more muscle, and you may have a little bit more, or at least maintained bone density, than you would have if you weren't doing that for a period of time before that.
Right. And so just to clarify to our viewers as well, the stress in this case is a good stress. Isn't that right?
That is 100%. That's a good stress. We do want stress in our lives. It is a good thing in some degree. Not all stress is bad, and this is definitely a good stress, making sure that you're trying to improve yourself inside and out.
Awesome. Yeah, and the way that muscles can change you from the inside of you, whether it's the effect that it has on your bones or on your metabolism, is awesome. So let's go into that for a second then. How else can muscle sort of influence somebody's health other than helping them with maintaining their bone density?
Right, yeah. So I mean, if we want to talk about the muscle itself, if we want to talk about muscle itself, I mean, the fact that the more activity that we do, whether that's aerobic activity, where we're either walking, running, swimming, cycling, we start having increased what we would call mitochondria in our muscle cells, which are basically like energy factories. And the more energy factories we have in our system, the more energy our muscles are using and creating energy in order for us to function. So the more energy factory that you have, or the higher level of energy manufacturing that we have, the greater energy you're going to have throughout your day. So you're going to be able to do more. You're able to not feel exhausted at the end of your day. If we wanted to take it and go through metabolism itself, it's going to help with gastric motility. It's going to help you digest a little bit better, just because you are moving around more. You're going to probably be taking in more water, which is good for you anyway. So that's going to keep you hydrated to a degree, as long as you're taking in the appropriate amount of water, which will also help with gastric motility. You're going to get rid of some of your waste through sweating if you are sweating during your workouts. So you're going to get rid of urea, and you're going to get rid of other different waste products that we normally may not have been getting rid of, and you may be only using your kidneys. So it may be improving your kidney function as well. Same thing, because you're a little bit stronger, you're doing a little bit more, you may be giving better stability to your spine. The same thing goes for any of our joints. Our joints are lubricating every time that we move. So the more you're sitting, the more in that, if we want to take it this way, not to say that you're dehydrating your joints, but you're not replenishing it with fresh fluid. So anytime that you are moving, you are replenishing it with every kind of movement that you make. So you're flushing out old fluid and you're creating new fluid through that movement. So basically, it's like every day you're giving yourself an oil change.
Wow. I've never even thought about it like that. There you go. Like giving yourself an oil change, keeping things lubricated and moving.
Correct. And that goes for every joint in our body.
Awesome. Awesome. Okay. So just to go back for one moment regarding the stress that you could put on somebody's body to create overload, to create changes in somebody's muscular system, right? Mm-hmm. What is the difference between applying stress to somebody's body when they're, say, 20 years old versus applying stress to their body when they're 50 or over?
Right. Yeah. So I mean, it's always a relative thing, and that's part of why, with you and me, we always sit down and we have that relationship talk first. We always get to know who we're talking with first, to understand what your level of activity currently is, where you want to go, and also take it for, what other things do you have going on? Do you have other medical history things going on? Do you have high blood pressure? Do you have diabetes? Do you have high cholesterol? Do you have do you have other injuries in the past? Have you had surgeries? So if you've had any of that, it's all relative to what you specifically need. And then, it's layering on for what you can do and what you can't do, and figuring and trying to bring up that level of what you can't do to everything where you can, and then kind of pick it up from there, and kind of build and build and build until we get to your goal. And if you want to keep going, we'll keep going. And it's just, as long as you want to keep improving yourself, that's all we need to know, and we can take you there. It just takes that time.
Yeah, man. No, I mean, that's a powerful, that's very insightful there. You're talking about how it really depends on the person that's in front of you.
Right, 100%.
Okay, gotcha. Okay, so what are some things, because you mentioned there are some things that, for example, a particular person might not be able to do. Is there anything that we could say that somebody over 50 shouldn't be doing when it comes to exercising? What do you think?
So I would say that's a little bit relative too. However, I would say there is not necessarily a limit. There are people out there who are up in their 70s, their 80s, who are deadlifting hundreds of pounds. There are people in their 90s who are running 100-meter dashes. So, I mean, it's not unrealistic, but it's all relative to what you do have going on in your body itself. I've taken someone who, and I know we're jumping ahead because I know you wanted to ask specifically about people who I have over 50 who I've helped. So I am jumping ahead a little bit here, but it does fit into what I wanted to talk about. Only because it's a very specific story, and it's someone who is very grateful for what I've done for him. This gentleman, he's 64, and he likes to work out. He likes to do things on his own. He likes to stay healthy. So he's already in that whole fitness. He's always gone to the gym. He's always weightlifted. But he was about a week away from having a shoulder replacement. And he was, he had some pain, but he couldn't get his arm above here. He was having very significant trouble. He's been to physical therapy before. He's been to a bunch of different people. He went to 3 different surgeons to see what they can do. And the only answer that they told him was that he needed to have a shoulder replacement. And my friend, who is a family friend of his, just happened to be going to visit him. And he was from Jersey. My guy is on Long Island here. And he says, something's not right here. You'd only have minimal pain. Let me take a look. And he just happens to be a physical therapist as well. He's like, you need to see my friend Rob. You need to do this. just because I don't think you need this surgery. So I saw him, I think, the first session, and by the time I had that first session with him, he was 2 days away from having that surgery. And within that first session, I was able to improve his just flexion range of motion from about here up to about here, and he had minimal to no pain at all. We continued to work for about 8 or 9 weeks after that. I mean, he continued to improve. He was able to regain most of his motion. He was still missing a little bit just because he did still have arthritis, but he was still able to return to push-ups, regular push-ups. He was able to return to pull-ups. He was able to get back to the gym and do what he needed to do. He did have some limitations just because of the arthritis wasn't letting him. He was having some level of discomfort in some positions, but he's still pushing it. I know I still talk to him. It's been about 1.5 years since then. Still in the gym, still doing what he loves to do, still hasn't had shoulder surgery.
Wow. So even though this person had arthritis, he was a couple of days away from getting a shoulder replacement surgery. Through exercise and through all the good stuff that you did with him, he was able to regain some motion back. He was able to be a little bit, he was able to have better sensations in his shoulder. Kind of
right.
that pain was down, and he's continuing to exercise even till this day.
Yeah. So I mean, it's just because someone like we've been talking about already. Someone didn't listen to him. Somebody didn't sit down and ask the right questions to him. And somebody didn't touch him in the right areas of his shoulder in order to get him to release and relax. So he's able to regain function, take pressure off of the shoulder joint itself. So, when we first started doing push-ups and whatnot, even like an elevated push-up where he's doing a push-up from the table, where his feet are on the floor, his hands are on the table, he was having clicking and what I would consider ratcheting. So like if you ever think of like a ratchet sound, where it's like clunk, 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 that was going on in his shoulder. But once we gave him the stability that he needed, and just from general exercise and strengthening, he got rid of that, and he was able to lower from the top of the table all the way down to a regular push-up and do push-ups repetitively without having that ratcheting, without having any kind of issues like that. Full smooth motion, and he felt great.
Wow. So this is a gentleman who's over 50. You mentioned
64.
64.
Yeah.
64. He went from almost practitioner, can't be understated. And when we're talking about the people here, your everyday kind of over 50 person, what kind of, as a practitioner, I mean, what kind of landmines are you looking for inside of their bodies? What are sort of the what are you earmarking as, this is something that needs to be taken into consideration?
Right. So I mean, my assessment, my examination begins when you first walk into the room.
Yeah.
I see how you're walking, how you're moving. As soon as you walk. As soon as you come in eye contact with me, I'm watching how you're moving. And then like after that, I start even listening further because it's always like eyes, ears, and what I'm touching. It's what I see, and then it's the first thing you say to me is when I start taking notes in my head. I start listening to how you answer questions. I listen to the hesitation that you may have in your voice or the nervousness that you may have, how much you're fidgeting, how much you're moving around, how much depending on what kind of issue that you're having. So if you have back pain and you're doing this the entire time that I'm trying to talk to you, like that's giving me your level of intensity of what you're dealing with.
Right.
Then we break it down to how you're moving, how sensitive you are to things. It's a full experience on my end of trying to get to the depth of what you need and what you're experiencing. So my earmarks or my landmines, it's always first you're always trying to get rid of red flags. You're always trying to make sure that there isn't something that I need to send you to someone else to, like cancer or something that's significant or severe like that. And making sure you're not having any referrals from any of your organs. If there's anything like if you have back pain, there's a lot of things that can refer to your back from one of your organs. So making sure that that's not there is paramount. But then also, making sure that what I'm hearing and listening to is specific to what I think it is, and then also making sure that it is appropriate for what I think it fits in. It's never, nothing is ever textbook. I want to say like very rarely is anything textbook. So it's always different nuances, things that you pick up from seeing multiple people with the same issue and figuring out, what could be done differently. I've never treated anybody the same, I don't think. Everybody's always different.
And for everybody watching, this is how you know this is a professional. We're listening to Dr. Rob here, and this is a guy who's saying up front, nothing is ever textbook. He's never treated any two people the same. I mean, these are the things that you guys need to be looking for when you're thinking about potentially working with somebody. If you're going to somebody and they're not assessing you and they're not trying to go into the depth of what you really need and what might be going on with your body, then that might not be the right person for you. Let's talk about some more positive things though. What is something that somebody over 50 can start doing to start working on their muscle health right away?
Right. Yeah. So I mean, our Facebook user here who did comment, she said, is walking good? And walking is, like I said, a good start, especially if you haven't done it. If you're someone who may still be working and someone who has sat at a desk for most of your career, walking and doing something rather than doing nothing other than sitting, that's going to get you a good start. You're doing more than what you were doing before, so it creates that overload that we were talking about. So that will get you a good start. The same thing, I talked about before, just starting to do just more general activity. So you're getting in and out of a chair multiple times, or picking something up from the floor, or lifting something into a cabinet. It's all simple stuff that we don't think about or take for granted. It's just general things that you could be doing a little bit differently or a little bit more of that could be a good start. Same thing goes for, going in a pool if you like to go in the pool. For those who do have bone issues, so osteopenia, osteoporosis, being in the pool, walking in the pool is okay. It's not going to give you that loading that you need in order to prevent bone loss from happening. So I do want to clarify that, because I know that's one of the misconceptions I see is like, because someone has brittle bones or weaker bones, they're told that they need to avoid impact. They can't fall. But at the same time, doing a disservice by, doing a lightweight activity or a minimally impactful activity can be not necessarily harmful, but it can be something that is not serving you the way it should be. So like that person mentioned in the comments, walking may be good for you because you are adding that little bit of impact, but it's relative to what you can tolerate. So if you can tolerate it without feeling if you go out for a walk for 20 minutes and you don't feel any extra soreness, achiness, either later on that day or the next day, then you can tolerate activity, and that's good. Maybe you can do more the next day or the next week, and that's where you kind of push it. And that's definitely a good start. I hope that answers that question.
Yeah, no, definitely. I mean, you're mentioning walking. You're mentioning also how you might want to do more. You might want to end up pushing it, and I think this comes back to the idea of overload, right?
Right.
So if you're somebody who walks a lot already, and you do some more walking, is that considered exercise that's going to be beneficial for a person like that?
Yeah. So, I mean, if you're someone who's already active, but you want to improve in some other way. So, for example, if you're someone who walks and still has osteopenia, osteoporosis, maybe this is on top of something that you may have already with where you're getting through the medical side, where you're getting injectables like Prolia or some other injectable medication like that to help minimize your bone loss. You may need to involve some either some resistance training, or you may need to involve some other activity like cycling. It's another minimalized activity, but you're able to do that maybe a little bit better than if you went out for a run at the age of 62. Running can be very complicated, and if you've never ran before, not understanding the appropriate mechanics may be a little bit difficult. It may give you some more of that extra pain or discomfort than if you went out for a bike ride, for example. If you are going to do something like that, getting in front of someone like me or you who does have that kind of understanding of what you should be looking like when you're on a bike, or what kind of resistance or what kind of speed you should be going at, those kind of things are important. So again, for someone who's walking and already is an avid walker, doing more walking, unless you have all the time in the world, is okay. But at the same time, it's got to be relative to what you're able to do.
Yeah. No, and you know, that's a very high level thought. I mean, once again, talking about the relative movements and how important that is to the specific person that we're talking about. So let me talk about one specific person, for example. If you're somebody who's 62 and you feel like you can't run, right? How do we get somebody who's 62 and when they run, they feel aggravation in their knees or ankles to get to a place where they might be able to run without feeling that aggravation in their
Right.
hip or
Yeah,
ankle?
so I mean, this part goes into my treatment method or even my examination when I first see you. So if I notice that, for example, if you're that 62-year-old person and you walk into my clinic and you're not putting as much weight on your right foot as your left foot, and I got to figure out where that's coming from. Is it coming from your ankle? Is it coming from your foot? Is it coming from your knee? Is it coming from your hip? Is it coming from your back? I have to ask you questions. I have to understand where your history is. I have to see how you move. So I need to break down movements. I need to make sure that you have appropriate motion in each of those joints. I need to make sure that you have appropriate strength in each of those joints. We're adding on doing some kind of powerful activities where we're doing repetitive steps like stair climbing, because that is a power activity. And once you have power, then we can start talking about leaving the ground, because running is a different than walking in the sense that there is a point where both of our feet are not on the ground. There is a flight phase, and that's the difference between walking and running. You have that flight. You're in the air. And that time that you're in the air, you need to be able to absorb force in each of your joints up along the chain from your foot, from that first contact with the ground, whether that's your heel or whether that's your toe, all the way up to your ankle, knee, hip, lower back, and even up into your neck and shoulders. If you're not able to tolerate that stress, we're not even talking about running at that point. We still have work to do and still things that we need to work on. And that's getting rid of pain. That's also avoiding pain while we're doing the activity.
100%. So being able to tolerate the stress and going from somebody who's 62 and feeling pain when they're running to getting them to tolerate that stress, to be able to run pain-free and to be able to stay pain-free while they're running. What is this part where it's like, okay, let's help them tolerate the stress better? What is that? How do we do that?
Yeah, so I mean, again, this is like more individual question for each person. It could be that, they may be more knee dominant in the way that they move, where they're not getting as much hip motion. So maybe I need to improve their hip motion so that they're able to use their hips better in order to walk better, for example. And that could be broken down through a number of different exercises. That can be broken down through a different number of movement patterns. And maybe the endurance in their hip is maybe not as much as they need to. So we need to work on single leg stability drills, or we may need to work on different squat or lunge variations in order to improve endurance and through function in that way. It's definitely different and definitely individual. So it is very relative, and at the same time, it's definitely something that is individual. It's something very specific to everybody's different needs.
Right, 100%. And you mentioned things like teaching people how to move in a certain way, different movement patterns, creating stability, working on muscular endurance in some places where they might not have that, ability. So these are all things that can help with getting somebody to get to a place where they're getting pain-free. Is that right?
Correct, 100%. This is pain-free. This is performance enhancement. It's all the same. The only difference is one's in pain and one's not in pain.
That's it, right? The performance side is the not in pain piece.
Right.
And that pain piece. Interesting.
Right.
Dr. Rob. Awesome.
It's all hierarchy. It's just where you're at.
Right. So basically, you're saying they're in theory, right? And I know to our viewers this might seem a bit crazy, but in theory, there isn't much difference between what you would do with a 7-year-old, 70-year-old versus what you would do with a 20-year-old. Is there?
Yeah, I mean, if I have a 20-year-old in pain and a 70-year-old in pain with the same diagnosis, if we want to bring it down to that, so if you have patellofemoral tendonitis, which is you have pain in the tendon of your kneecap, will they be doing similar exercises? Probably. Will they still have quad weakness or thigh weakness? Probably. Will they have hip weakness and hip stability issues? Probably. Am I doing the same exercise with them? Probably not. And that's not because one's 70 and one's 20. It's just because that person may need something different than that person. and it's all relative. So whether you're having pain at 20 or having pain at 75, it's all the same.
Right. Age is irrelevant. What's relevant is what does this person have, and what can this person tolerate, and how is this person functioning right now?
Correct. Yeah.
Awesome.
And it's taking that person from where they are right now and where they need to go. And if they want to continue to push it, it's where they need to go. So, I mean, that one misconception, I just want to kind of go and lead into this a little bit.
Yeah, go for it.
You know, physical therapy, to a sense, is one of the few practitioners where we discharge people. And I don't see it in that sense. I'm always staying in conversation with a number of my clients, regardless of whether they're actively working with me or not. I'm always checking in on them, because, you know, it's not, when you go to your dentist, you're never discharged from your dentist. When you go see your general practitioner, you're never discharged from your general practitioner. And, you know, one of the misconceptions is, you know, once you're out of pain, that's only a start, because there was a reason why you were in pain in the first place. And if you don't take it to that next level, then, you know, you're going to end up right back down the bottom, which does happen a lot with the current practitioner model for physical therapy. If you go to a regular general person rather than a specialist. So going to that generalist who's going to take you and get you out of pain, which is very easy to do. It's getting you to the next level is what you need to do, and what not only the practitioners kind of get as a misconception, but also the people who attend physical therapy, people who are in pain, kind of give as a misconception too, like, oh, I'm out of pain, I don't need to come to you anymore. That's not the point. You were in pain for a reason. Just because you're out of pain, just because you're just right on the cusp of being in pain or not being in pain. Getting you out of pain and keeping you there is where you need to finish, if you want to continue that, if you want to state that as being finished.
Right. It's almost like there's no finishing.
Right. If you want to keep going, we can keep going.
Yeah.
And that's not necessarily something that you have to stay with me for the entire time. If you have questions based off of what I've educated you on, I'm always happy here to answer things. If you want follow-ups every now and then, I'm more than happy to give you a follow-up to help bring you up to that next level where you want to go. If you want to continue working with me, you can continue working with me. If you don't, I'm good with you. It's whatever you want to do and where you want to go and take your life. That's how I work.
No, and you know, that's an amazing thing that you do. You educate people on where they're at and how they need to kind of be as they, you know, either move away from working specifically with you, or if they're or if they're continuing to work with you, you continue to educate them on what you're doing, why you're doing it, and how this is going to help them with whatever it is that they want to be doing.
Mm-hmm.
Awesome. So where can people find you, Dr. Rob? I mean, if we're talking about anybody who wants to come see you, they're having some pain issues and they want to come find you, where can we bring them?
Sure. Yeah. So right now, you know, my business is half mobile and half in a clinic. So if you do need me to specifically come to you, if you can't necessarily get to my location, I can come to you. Or if you're having issues getting to the clinic because you have a crazy work schedule, I can get to you and bring everything I need to treat you in your home. But you can also come to my clinic. My clinic is right now in Rise Athletics down in Farmingdale at 47 Heiser Lane in South Farmingdale. And, you know, as Ahmed put up on the screen there, you know, you have my email there. You have my Instagram contact there, ascent_PT_multisport. You have my phone number right there to contact me as well. And you also have my website if you want to check me out. I'm more than happy to answer any questions you have, regardless of whether you want to work with me or not. That's how I work with my business. It's always from that first conversation where we have and making sure that I'm the right fit to help you out. Because I don't work with everybody. I work with people who want to help themselves and people who want to make themselves better. So that is basically how I like to do things.
Love it, man. Love it, man. You need the people who want to work on themselves to be in your world, because you're a person who works on themselves all the time, and I know that about you, man. So thank you so much for coming on today. It's
anytime, man.
It's been a real incredible pleasure, and I hope all of our viewers enjoyed this conversation as much as I did. Thanks again, Dr. Rob.
No problem. Anytime.
All right, man. Have a good one.
You too.
Take care.